So Larry, give our listeners, a real world example of maybe a pre-adolescent child with anxiety. Out beyond Piglet, what does that actually
Yeah.
look like?
Yeah.
In an actual child, what does that actually look like?
Sure. So imagine, if you would, an 8-year-old who, every time they're getting ready for school, just before the family's about to leave for the day, maybe they have their lunchbox, they have their backpack, but suddenly there's always seems to be a tummy ache or some rumblings there, or maybe a little bit of headache. And so the length of time it should take, the 10 paces from, the mudroom or from the kitchen to the car, instead becomes, maybe a 15 or 20-minute ordeal where there's, maybe some bribery, coercion, tickling, I don't know, but to get them there. And so you can imagine kind of a kid who just maybe the same 8-year-old who's also having trouble initiating his day, and getting in the van might also, occasionally ask parents about the finances of the home, even though the child has experienced, no periods of material lack significantly, or poverty, or prolonged, absence of the things that they really need. And so again, the child might be saying things like, well, my stomach hurts all the time, or just asking for a lot of, reassurances. Is everything okay? I'm looking forward to getting a job next weekend. So that might be, the tone of a young kid who might be struggling with anxiety.
And how does anxiety look different at different ages, from preschool on to older adolescence?
Yeah, that's a really good question. I think, it depends. So when we talk about anxiety, usually it's kind of an umbrella term that refers to a lot of different flavors of anxiety. But for teenagers, as you get older and they get a little bit more self-reflective, it tends to be more outward. So you might see a little bit more kind of social anxiety, performance-related anxiety, in an older kid, whereas in younger kids, you might see a little bit more separation anxiety. So, you're going somewhere and they have difficulty, separating. Maybe going to school is part of the separation anxiety. Maybe being in the grocery store and parent asks them to grab a box of cereal and come back to the aisle. So that level, they could be really overwrought with emotion around that, but you don't expect to see that perhaps in a teenager. The anxious teenager might say, mom or dad, I feel really anxious, or might not even use the term anxious, might talk about some physical somatic symptoms, and you might see them shadowing. That's the term we'll sometimes use, where maybe they're covered in a blanket, and your usually gregarious, independent child seems to be huddled next to you everywhere you go. You're trying to work in the office, they want to do their Zoom classes in your office. You move to the kitchen, they suddenly get hungry for a snack too. And you're wondering, what's going on here? Why are we having different, difficulty separating? So that might be some of the differences.
Huh.